Thank you very much. I want to begin by saying, I'll begin by saying that when I was a child, I always had a little dream, maybe I could be a rock star, So I came here today and all the cameras, and all of you people, so it makes me feel like a little bit, some of that dream is coming true. So anyway, I really want to thank you all for coming here this evening. I know you had a long day at work, while my wife Anat and myself, we were just touring your beautiful city, and we've had wonderful days here. And I'm very honored and happy to accept the invitation to talk with you and to share with you some of the research that we've been doing for many years on the emotional development of children, and particularly children on the autism spectrum, the attachment they form. And that will be the focus of what I will talk about. The emotional connection that children develop to their parents, to their caregivers, children with autism as well. That will be the focus. And I think it's very, very important. And I'm happy that there are many of you who are interested in those relationships. I also understand that in the audience there are students, which is wonderful, because I hope this will kind of encourage you to continue in this direction. I understand that there are therapists who are working currently with children on the autism spectrum, and you might have your own professions, your own ideas, and it will be very interesting to see how what you know and what I will be talking about, whether it fits together, whether it's different, and it will be very interesting if we could have even a little bit of dialogue about that. I also know that there are parents in the audience here of children on the spectrum, and I value that. I'm happy. I'm happy you came. And I hope that what I say will be helpful for you, and I also am very open to questions or comments, agreements and disagreements with the ideas that I have to share with you today. I'm a developmental psychologist. What does that mean? I do research on children. I'm mainly a researcher. My background is in clinical psychology, so I'm very interested in intervention and clinical work with children, with parents. And I think it's very important that our clinical work be informed by the most updated research. In the field of psychology and many other fields, there is sometimes a very big gap between the clinical work and the research. And sometimes there is not a lot of connection between the two. And I think it's very important that there is a connection, there will be a connection. And I come from the research to the clinical, and I work with people who come from the clinical to the research, and together we try to build knowledge to help the children. So what you will hear is a researcher's perspective, but with a lot of clinical implications, and I hope you will see these clinical implications. So the title of my talk today, Secure Attachment in Autism, the Importance of Maternal Insightfulness. So the first part of the talk, till we take a break around 6 or so, a little bit later, we will take a little break, so you know when you can go to the bathroom. It's very important. The first part will be devoted to attachment, to the child's part in the relationship. The child forms a connection, a bond, an attachment, a relationship with the mother, with the father, with the grandmother, with whoever is taking care of the child. And I will talk about that in normal development, typical development, and I will talk about that in atypical development in the case of autism. And then in the second part of the talk, I will talk about insightfulness, so the importance of the capacity to see things from the child's point of view, to put yourself in the shoes of the child, to see the world and to feel the world from the child's point of view. This is a very fundamental point in caregiving. It is true in all relationships between adults and children, and it's important, and it's even more important and more profound in the case of children on the autism spectrum, because the way they experience the world from the sensory level, you know, the way they feel things, the way they touch, the way they see, the way they process information, and is sometimes fundamentally different than the way most of us feel it, see it, sense it, hear it, okay? And it's very important that we put ourselves in the shoes of the child. That will make some of the behaviors that may seem bizarre, hard to understand, maybe violent, maybe very closed down, or just strange. Some of them may gain much more meaning if we put ourselves in the shoes of the child, if we experience things from the child's point of view. That will be what I will talk about in the second part. And throughout, again, everything that I say will be as much as possible based on research methods, on data, on quantitative data, and so on. I will not give you a whole lot of research this evening. Maybe for the morning you can, you know, listen to more research, but in the evening it's hard. But I will give you a little bit of our research findings so that you get a little bit of a feel for how we approach this. So this is today's presentation. First we will talk about attachment in typical development. So just this concept of attachment, so that we are all understand it in the same way, that we understand it in the same way. And then I will talk about how clinicians and researchers dealing with autism, how they viewed the connection between autism and attachment. There's been a big change in the last decades, and I will explain the change. And then after the break, parenting that supports secure attachment in autism. I will introduce the concept of maternal sensitivity. What does it mean to be sensitive to a child with autism? And then insightfulness. And I will also talk about another element. I hope I have time for that as well. Resolution of the diagnosis, learning to accept, to live with, to come to terms with the diagnosis of a child. Every parent wishes to have a healthy, typically developing child with no problems. That's a universal wish. Realizing that your child is not on that course, can be not on that developmental pathway, can be a profound can lead to a profound sense of loss, to anger. Why me? Why did this happen? And so on. Many feelings. And parents need to go through a process of dealing with this reality. It's in a way, it's a lifelong process. And I will talk more about that and the importance of that, and what we, and when I say we, I mean therapists, what therapists should do in order to promote resolution, to promote acceptance. And I can tell you the answer to that now. In my one answer, in my point of view, the same way that we think it is so important for parents to be insightful with regards to their children, to see and feel things from the child's point of view. It is equally important for therapists to see and feel things from the parent's point of view. You know, to understand the experience of a parent, okay? And something sometimes happens when we move. Many of us, many of you are parents. Certainly I am a parent. But when we move from being a parent to being a professional, sometimes we lose some of that sensitivity. And that's very, very important. And you will see that once you use this point of view, it can open doors, very important doors, for the parent and consequently for the child. There's a chain of relations here. So I will get to that when it's nighttime already. This is a very important slide to say right in the beginning. I talk so much about attachment, relationships, parenting, in the case of autism. But it's very important to emphasize that insecure attachment or difficulties in attachment are not a cause for autism. The cause for autism is not psychological. It is not a traumatic experience that the child had. It is not something that parents did or failed to do that created autism. And autism is also not something that attachment, a good attachment, can probably, it is not something that a good attachment can cure, that you can make it go away if you just are good enough as a parent. Autism we need to think about as some sort of a neurodevelopmental disability. It's a big mystery in the world. We do not know enough about the causes of autism. We do not know enough about the brain of children with autism, about the genetics, although there's clearly some genetics involved in autism, but we don't know enough about that. So there's a lot that we don't know. But I think one thing that is quite certain, we know it is not caused by psychological trauma. You know? Psychological trauma that happens to children is a very bad, and it causes many other things. And I can talk about that one day, but not autism, okay? So, and this is very important to emphasize. Also because in the past, some of you may know that in the past there was a theory, kind of a theory, that, you know, cold parenting, cold mothers, refrigerator mothers caused autism, okay? There's no basis for that theory, nothing whatsoever. And if you're exposed to that, or, you know, people say that or think about that, please know that this is not accepted as anything of value these days. But that does not mean that the relationships that children with autism have with their parents is not very important for their development. The relationship that they have with their parents is important for their development, like it is important for the development of every child, and maybe more so. Because for children who have typical development, you know, they have a lot of resources. We talk about resilience. I don't know if you're familiar with this term. You know, if they don't have the best relationship with one parent, they have a better relationship with another parent. Or if they have experienced some trauma, this will be difficult for them, but they can overcome it with support. Children who have inborn vulnerabilities, like kids with autism, but also other kind of disabilities, not only autism. I'm just talking about autism now. They need like extra help, extra support, more support than usual, okay? They need that. So if anything, my point of view, and I think research is also supporting that, children on the autism spectrum need a lot of caregiving that will be tuned in to their needs. And for us as professionals, it is our job to help parents understand their children better, understand what makes them tick, work together with parents as professionals, together with parents, to try to figure out the child's experience. And once we do that, okay, maybe we won't find, you know, the final answer, but it will move us towards helping the child experiencing the world as a safer place, as a more organized place, as a place that the child can tolerate better. And we will see enhanced development within the limits of the disability of the child, okay? So it is exactly, just think about a child who has hearing impairment or vision impairment or motor impairment. We don't think that something in the relationship caused the child to be, having hearing impairment. Of course not. Hearing impairment is something that was caused by some reason, okay? But when they had hearing impairment, they may need more help in order to develop, okay? So use that way of thinking when it comes to autism as well. So let me talk a little bit, really quick, about the history of the term autism and attachment. So in not many years ago, if you looked at the DSM-3, the DSM is like the Bible of psychiatric diagnosis. So if you think about DSM-3, today we have DSM-5, So DSM-3 in 1980, it's written autism, a failure to develop normal attachment behavior. Failure to develop normal attachment behavior. This is simply not true, and in 10 minutes you will see the evidence for that. Okay, but that was the dogma, that was the doctrine, that was the way the development of children with autism was seen. DSM-3R came 7 years later. Attachment of some autistic children is bizarre, no or abnormal seeking of comfort at times of distress. This is mostly not true, and I'll talk about that later. Okay, and I mentioned that both Leo Kanner and Bruno Bettelheim coined this term refrigerator mothers. And if at any time, our profession, my profession, well, they were psychiatrists, I'm a psychologist, but us as mental health professionals did damage, like real damage, it was this term, refrigerator mothers. It is not only offensive, it has no empirical basis. They did not know that these mothers were actually cold. It was a theory that something caused these children to withdraw into an autistic shell because of the coldness of the mother. And they didn't realize that maybe some of the mothers may seem distant as a reaction to the autism of the child, not as a cause of the autism of the child, okay? Because when you interact with a child who gives little back and you have no support, one way you can react is by withdrawing, and you may seem more withdrawn or distant, okay? So this was a real disaster, this way of looking. And unfortunately, I don't know the situation here in Georgia, and I don't know about the training that you received and so on, but I know that in many other places in the world, including in my country, well, no one talks today about refrigerator mothers. Okay, no one talks about it, but there are other ways, more subtle ways to talk about it. And I think when you work with parents and they sense that you think that they did something wrong, this is really a problem for the therapeutic relationship. Okay, so that's why I'm putting it on the table. It's really important. In 2004, Anne Rutgers from Holland did something that we call a meta-analysis. Meta-analysis is when you combine many studies together and you do some statistical process called meta-analysis in order to learn the overall picture. And she found 10 studies of attachment and autism in that year. Since then, there have been more. Together, 287 children. The main findings: 50% of the children with autism or PDD, which was a somewhat milder form of autism, show secure attachments. Okay, 50% show secure attachments. So I want to emphasize, 100% formed attachments. 50% of them were secure. 50% of them were insecure. But as I will explain in a few minutes, 30% of children with completely normal development have insecure attachment. Insecure attachment is not psychopathology. It is a form of attachment that is less optimal. So yes, there were fewer secure attachments in children with autism, but still 50% had secure attachments, okay? This is like, it should change the way you think, because it says that, you know, the percentage of secure attachment is somewhat lower than in typical development, but not really low, okay? Yes, 50%, the proportion of children with autism with secure attachment was lower compared to children without autism. So 50 instead of 70. Okay, that's understandable. A little bit less secure, but not to a large extent. Okay, so this meta-analysis, this review really changed the way we think to understand that attachment is developing in these children and developing in ways that are similar to typical development. Now, how do you measure attachment? Well, a very well-known developmental psychologist, her name was Mary Ainsworth, developed an observational procedure, and any one of you who's learned something about child development probably heard about Mary Ainsworth and probably heard about this procedure called the strange situation procedure. Can you show me with your hands if you've ever heard something about the strange situation? Not so many. Okay, so you have an opportunity now to hear about it. So the idea is that by the end of the first year of life, infants form a specific emotional connection to the mother. Not only to the mother, by the way, they form this connection to anyone who is a permanent caregiver. It could be the father, it could be a nanny, you know, someone who takes care of the baby every day. Yeah, they will form an attachment with that person as well. Grandmother, maybe older siblings. But we are going to talk about mother now, because in most cases, the mothers are the main caregivers. Okay, so by the end of the first year of life, children form this connection, specific connection to the mother. As you all know, if you've ever observed babies and mother, the babies at this age have this connection to the mother. When they realize that the mother is there, they explore the environment, they play, they may walk away from her, but when they walk a little bit further away, they will look back to see if the mother is there, right? To use her as a secure base, we say, a secure base for exploring the environment. And if the mother is leaving, okay, then the child immediately will send signals of seeking proximity, seeking closeness, wanting to be close to mother, okay? It's hard at this age to leave babies with babysitters. At 3 months, it's rather easy, because if someone nice comes and plays with the baby after a few minutes, probably you can leave and the baby will be okay. Between 9 and 12 months, you know, every mother knows it becomes much more difficult, because the connection is very specific, has become very specific. The baby doesn't just want anyone. The baby wants the mother, that's someone that they have a shared history with. And this is what we mean by attachment. Once the baby gets the attention they need, okay, from the caregiver, once they feel the mother is available to them, then they can calm down and explore the environment. So life is kind of, for a baby in this age, is between exploration when I'm happy, to learn about the world. I can crawl, or maybe some babies at 12 months can walk, and the world is very exciting, full of wonderful things. But when I'm stressed, when I'm upset, when I'm hungry, when I'm tired, I look for the attachment figure. I send signals, I need you. I cry, I approach the mother, I cling to the mother. And when I get the proximity and the availability of the mother, I calm down, okay? And then I can return to more exploration. Okay, that is the basic idea of the formation of attachment. So this was Ainsworth's idea, together with John Bowlby, of course, the well-known British psychoanalyst and psychiatrist. And she developed a laboratory procedure in order to assess whether the child has a secure attachment or an insecure attachment towards the mother. What we do in this, and she called it the strange situation. So you bring a mother and a child to the laboratory. Well, laboratory is not with, test tubes. Laboratory is a playroom with toys and so on, but we call it the laboratory. You bring the mother and the child to the laboratory, and the strange situation involves 7 episodes of 3 minutes each, and the stress is getting stronger and stronger. So in the beginning, the mother and the baby are playing together. You'll see it in a second. And then a stranger comes in. So it's a little bit more stressful because the child doesn't know this person. And then the mother leaves, okay? And then she comes back. Okay? And then she leaves again, and this time the baby is left completely alone. Very stressful for a baby of 1 year to be completely alone without anyone in an unfamiliar room. Then the stranger comes in, and only then the mother comes in. Okay? So what we're going to see now is the strange situation, a shortened version, not the whole 21 minutes, of a strange situation of a child with typical development, okay? Normal kid, normal child, baby, at 12 months with his mother, and I will explain what we see as we go. Are there any questions for now? Are we understanding ourselves? Okay. Yes? Say, go like this if it's yes. So you see the baby, you see the mother, there's a room with toys, everything is happy, So he's showing something to the mother, very normal behavior. And of course, he's not upset. So now I jumped ahead a little bit, and someone that the baby doesn't know, we call her a stranger, okay? From the child's point of view, it's a stranger. She comes in and plays with the baby. The mother is still sitting there. We told the mother, you sit there, don't engage with the baby, but if the baby turns to you, you respond to her, okay? So the stranger comes in, and this little kid is very happy to play with her, as you can see for a few seconds. In the relationship, in the interaction with the stranger, right? You may think, oh, he forgot, he forgot his mother. The mother is sitting on the right here. But what we say is the mother is in the back of his mind constantly. He knows that she's there. That's what enables him to interact with the unfamiliar adult. So you see immediately when the mother leaves the room, all the exploration goes down. No interest in the toys, no interest in the stranger. The system tells him, I need to be close to my mommy. I'm in an unfamiliar place and I need her. And I have these tools that nature gave me, which is crying, looking, and doing everything I can to be close to my mother. And she tries to say, no, let's play a little bit until mommy comes back. So he needs mother. It's not enough to have someone else who's very nice to him, picking him up, saying to him nice words and soothing words. No. There is a specific relationship that has been formed at the age of 12 months already that is to the mother, and that's all that he's interested in. We know today also that his entire physiological system right now is very stressed also. Okay, it was hard to hear, but she knocked on the door. She was told, knock on the door and say his name and mommy is coming. The moment he heard her voice, okay, she didn't come in yet, you see? The door is still closed, but he heard her voice. That moment, he stopped crying. You see, he's silent. So that tells you something about the development of secure expectations, okay? There is an expectation. that this child has formed based on hundreds and thousands of opportunities during the entire first year of life, that when he is in need, then the mother responds to that need. Now, this was violated. She left him in this unfamiliar place. Terrible, terrible, sad situation, scary situation. But when he hears the voice and the knock on the door with his name, it like the switch is turned off, okay? Immediately he's calm. She picks him up. You will see he's actually already happy. He's already pointing like he did before. So this looks exactly like what we saw before there was a separation, right? The kid is walking around, pointing out to all of these things and so on. So he's back to feeling secure because of the presence of the mother, okay? Now we're going to be very cruel, and we're going to take the mother out again, sharing toys with her, of course, asking for her help. Now she leaves. She says, I will come back in a few minutes. Okay, that is not what he wants to hear. That is not helping him. I'm coming back in a few minutes. What do you mean? You leave me here. So all of the exploration immediately stops, and in comes, instead of the mother, comes the stranger, okay? The idea is to see whether the issue is that I'm alone, or the issue is that mother left. So if the issue is that I'm alone, now the stranger comes in. She's very nice, she's kind, okay? So will that calm the baby down? Let's see. Mother will come back, she says. Okay, not interested. I want my mommy. Okay, now the mother comes in. That's it, okay? He cried for a few more seconds. He's already calmed down. He was very upset. There was no question. Very upset. But the presence of his mother helped him really calm down. And you will see, he's already ready to do this pointing thing that he likes to do so much. She's still hugging him for a few more seconds. But he will go back to exploration. This is the hallmark of security, okay? The capacity to feel confident, to feel okay, to feel like somebody's hearing me, reading me, understanding me. The world was a terrible place a moment ago because they left me alone in this place. Horrible, horrible. So I do everything that I can to get back to the attachment figure that I know. And once I get it, things are okay. That's what he likes to do. Point and say this. Okay. So this is so beautiful in this example of what a secure relationship, how it helps a child cope with distress, okay? And when the relationship is secure, it is not that kids don't become distressed. Of course they become distressed when there's separation. But the capacity of the child and the mother to go back to confidence, security, calmness, relaxation. This is what they're good at, okay? This is what they've worked on for a whole year, really, from when the baby was born, and it's so effective at the age of 12 months. Okay. So you saw an example now of the strained situation, and you saw an example of a secure child in the strained situation, and 70% of children, typically developing children, develop secure attachments to their mothers. So most kids develop. 30% develop insecure attachments. I won't have time today to go deep into what it means to develop an insecure attachment, but I'll just say this. Kids with insecure attachment need their mothers exactly in the same amount that kids with secure attachment. But in order to get attention from their mothers, some of them mix their signals with anger. Some of them are passive. Some of them pretend like they don't need the mother. We call it avoidance. So there are other strategies that they developed in order to form attachments. But all children develop attachments to their mothers, including children who have mothers who are very incapable of fulfilling their attachment needs. So the only case that we have children who don't develop attachments are children who don't have an opportunity to be exposed to more or less a permanent caregiver, and that happens in institutions. Babies who are raised in institutions don't have the minimal conditions to develop attachments sometimes, I mean, usually, because they can be exposed to not one or two or three caregivers, but 60 or 100 different caregivers, okay? You cannot form 60 or 100 attachments, okay? You can form one or two or three and several. So if you don't have opportunity to form something stable, you will not develop an attachment. And that is a very serious problem. We call that an attachment disorder. But that is something very specific, most cases only for children who are raised by so many caregivers that there's not anyone specific that you could form an attachment to. All right, so now we want to see what all of this looks like in the case of a child with autism. So I'm going to introduce to you a child, we call him Ben. I want to say two things before I continue here. First of all, you are welcome to take pictures of my slides except of the pictures, okay? Please do not take any pictures of the children or the parents that I'm showing. They agreed very generously that I use these pictures for teaching purposes, but of course not for outside this context. Okay, and I want to say that the help of the parents of children with autism to do the research that we do is absolutely essential and is something that we appreciate very, very, very much. And we have developed kind of like a collaborative relationships with the parents who see the importance, even whether or not it will help their own child, they know that we are doing this work because eventually it will help children on the spectrum. And it's a collaboration, and I have an incredible admiration and thankfulness for the parents, in this case, the parents of this little kid that we're going to see now. So he's 3.5 years old. He participated in our study. I'll tell you more about the study later. He was diagnosed with autistic disorder. And today in DSM-5, those of you who may be familiar, it's called autism spectrum disorder. So the child has autism. His cognitive functioning is very delayed. So at the age of 3.5, he does not speak. He has some vocalizations. And in general, his cognitive functioning is delayed. So you will see now slides of the strange situation of this little boy. The same strange situation that I showed you, okay, just a minute ago with a typical developing kid, now with a kid who has autism. This child happens to be from a religious family, a more orthodox family, and that is why you see he has the earlocks, okay, on the side of his head. So we are beginning the strange situation just like I showed you, and you see that he's playing. He's playing by himself. You remember the child I showed you before brought things to his mother, showed things to his mother. Of course, this child has autism. He doesn't do those things. It would be wonderful if he would. But you can see that he's calm. You can see that he's happy, right? I mean, he's smiling. He's smiling kind of to himself. But he likes being, that is his kind of secure place in the room to sit there and play with the Play-Doh. So he's doing that. But happy, okay? Now he's looking at his mother. So this was a very quick look, just a few, not even seconds. But he is looking at her, okay? So she's sitting there. She's told not to initiate interaction, but to respond to him if he wants something. He doesn't want, he's just looking at her. See, he's even smiling at her a little bit. But continues to be completely absorbed in playing with the Play-Doh. So any one of you who has worked with children with autism and so forth, this picture can seem quite familiar to what you know. The child is absorbed in himself and doesn't initiate interaction. The stranger comes in. She tries to interact with him. He appears to be oblivious of her. But when she does this, she bends over to catch his eyesight. There is a quick, very short moment of shared gaze at one another. But this really lasts not seconds, milliseconds. Okay, you see his eyes, he's looking at her and immediately looking down. Okay, that's autism. Mother is leaving. You might have thought that this child is completely unaware of what goes on. It seems as if he's unaware of what goes on. Some clinicians and some parents say, oh, I'm here, I'm not here, he doesn't even notice. Okay? In most cases, that's not true. And we have the evidence to show that it's not true. Okay? He leaves everything. He runs to the door. He's a big boy, he's not a baby anymore, so he can open the door. He tries to open the door. He's crying. He's upset. You see his facial expression, right? You don't need to be a psychologist to know that this is one little unhappy child. And the stranger who says to him, in a minute, mommy will come back, don't worry, no help. Exactly the same way we saw with the baby, right? So it's very nice, stranger, you're very kind, you're smiling at me, you're a nice person. I'm not interested. I want my mommy. Okay, so he continues to be distressed, very distressed. So we send the mother in. She comes in. He goes directly to her. Okay, he doesn't look her in the eye. We know that that is an issue with autism. So eye contact is an issue. But he has his other way to show, I need you. I need proximity to you. And this is by just going to her, which is what he does. She kneels over. He stops crying immediately, just like our healthy little kid, our typically developing little kid from before. She hugs him. He doesn't look at her, but he calms down. This is very interesting. She goes to sit in the corner because that is what we asked her to do. Okay, we give instructions. Help your child calm down, and then go and sit. Don't initiate interaction, just respond. Okay, he follows her. You see his look? He's looking to the corner where she's sitting. It's like, I want to make sure that you're not going anywhere, right? Okay, so he's looking at her. This is called contact maintenance, and it's very clear attachment behavior. And once she's there sitting, he goes back to being, his little quiet self, absorbed in his play like he was before. Mother leaves again, Remember, there are two separations. He is very upset again, runs to the door, crying. Okay, stranger comes in, tries to comfort him. No good. Upset. Mother comes in. He turns his back to the mother, very typical of children on the autism spectrum, but holds the hand, right? You come with me. Now, our little baby at 12 months with typical development would never do something like this. But the function of the behavior, the purpose, the goal of this autistic child and the baby was the same. The goal is to be connected to the mother, okay? And once you have that goal fulfilled, there is like the button that tells you to calm down is pushed. You see, they stop crying immediately. So he's holding her like this, taking her with him. She bends over like she did before. She gives him a kiss. This time, because it's stress, he says, no, you come with me to the table, okay? You see, he's pulling her. He doesn't look at her. He doesn't verbalize at her. He has autism. These are his difficulties. But he has other ways to show his emotional need for closeness and connection with his mother to feel secure. And this is our job as researchers, as clinicians, to understand what are the ways in which the children are expressing these basic emotional needs. And the basic emotional needs for closeness, for protection, for intimacy are the same even when the child appears to be, quite autistic and cognitively delayed and all of that, Our job is to find the child's way to express those needs. And it may look different. It may seem impersonal. So for example, when he's holding her hand like that, we say, oh, he's using mother as a tool. He's not treating her as a person. Well, okay, he has difficulties. But what is the underlying function of this behavior? For what? Why? What is the goal in his mind? The goal is to feel secure. He takes her. She bends over. She says, oh, you're playing. That's nice, and so on. Now she's going back, and he's looking at her. Exactly the same thing we saw after the first separation, right? Do you see? You can see his look at her. He's checking. Are you there? This is clearly a sign of his attachment to the mother. And he continues to play with the Play-Doh as if closed in his own bubble. Now I ask you, is this a child in a bubble? Is this a child who lives, in a way which is disconnected from the human world? Or is this a child, the way we see it, who has autism and all kinds of difficulties, but has formed a secure attachment relationship to his mother? The organization of the child's behavior, the function of the child's behavior is exactly the same as a child with typical development. The way they show it is very different because they have autism. So I'm not saying that everything is typically developing with this child. That's obvious that it's not. But I'm saying that the attachment system has developed in this child in a way that is very, very similar to the way with typically developing kids. So in our study, we had 45 children like this little kid. They were between the ages of 2.5 and 5.5. Okay? And we did a very thorough diagnostic assessment of these children with all kinds of tools. You see them listed here, diagnostic tools. I won't go into the details of the diagnosis, but I want to just tell you that we wanted to be 100% sure that all the children in our study, had a formal diagnosis of autism, okay? So if a child had some other problem but not autism, they were not included in the study. Only children with autism, okay? So we were very, very clear about that. 25% of them were high functioning, which means their cognitive development was more or less within the normal range. 75% of them were low functioning, which is delayed cognitive development. And this is typical of the distribution of children on the autism spectrum. A quarter, 3/4 in terms of high functioning, low functioning. Okay, how many were secure? Remember the meta-analysis that I talked about half an hour ago? The Dutch meta-analysis said about 50% are secure. So we got 44, you see? The blue part in this slide. 44% of the children were like this little boy that you saw, okay? Had secure attachments to their mothers. They're all with autism, okay? So a little bit less than 50, but you know, this is a margin of error, okay? And then the rest had the other types of insecure attachments: avoidant, resistant, disorganized. I don't have time to go into what it means, each of these 3 types of insecure attachment. But the important message is that we confirmed in our study what the field has already shown, but we did it again, that approximately half, maybe a little bit less, of children with autism, where there's no question about the diagnosis. So it's not the case that these were mild cases or cases where there's a question whether the child really has autism or not. No, all completely unquestionable in terms of their diagnosis. About 50%, a little less, they are developing this secure relationship with their mothers. This study was only with mothers. Fathers are, of course, very important. Other people are very important, but we could only do it with the mothers, okay? So this is very important for us to keep in mind when we think about the development of these children. And the next step then is to ask, what is it that parents do that helps children develop secure attachments? Whether it is parents of typically developing children or parents of children with autism, like the children that I showed you today. And after we take a break, I'm going to talk about 3 important concepts: parental sensitivity, parental insightfulness, seeing things from the child's point of view, and parental resolution, coming to terms with the diagnosis. So we have a few minutes now for questions or comments, and then we will take, we have 10 minutes, and then we will take a break. So any questions, please? And you can ask in Georgian, and I'm sure there will be someone who would be willing to help you. Okay.